A cancer drug that costs $17 to make sells for $2,000 at the pharmacy. America spends more money on healthcare than any country in the world, and yet millions still cannot afford it. So, what's going on? Where does all the money go? Here's what's happening. Let's say you're the drug manufacturer. You make this life-saving pill for cancer, and it costs you about $17 to make it. But you don't sell it directly to me, the patient. First, you have to give it to a wholesaler, who then gives it to the pharmacy where you go and buy. But before anyone can get your drug, you have to deal with a very powerful middleman, the PBM, Pharmacy Benefit Manager. The PBM decides whether your drug is covered by the insurance companies, and that really matters to you because you want your drug to be covered. That's the only way people like me can afford to buy it. So the PBM says, you want to be on the list? Then give me a rebate. This is like a kickback you pay for every drug you sell. You don't have a choice. You have to pay the rebate. So to afford that, you increase the list price of your drug. So a drug that cost you $17 to make is now $2,000 for me, the patient. This is why Mark Cuban walked in and changed the industry by building something called CostPlusDrugs. They simply cut out the middleman, the PBM. They buy the drugs directly from you, the manufacturer. They add a 15% markup, $5 pharmacy fee, and $5 shipping fee. No rebates. This is what happened when they did that.
There's a drug called imatinib for chemotherapy.
Right.
That when we started, the price of imatinib, if you just walked into a big pharmacy, a big chain pharmacy, was going to be $2,000. You go to CostPlusDrugs.com, it's under $30. There's a drug, droxidopa, right?
That's just insane.
I had a friend, Landon, who was in a terrific car crash, and he needed this drug, droxidopa, and lost his insurance. It was going to be $30,000 every 3 months. I'm like, let me just check to see if we can get it. $64 a month, and the price has gone down since. All because we were transparent.
I have been reading comment after comment of how CPD and companies like this have saved people in America. And more people need to know about this. It is not perfect yet. They don't have all the drugs covered, and insurance companies still don't cover costless drugs. But when a drug that costs $2,000 the pharmacy is $17 on their website, you don't really worry about insurance. You just go buy it. So before you go, send this to someone who is paying way too much to get their drugs in America.